everybody, it's Cheyenne and welcome back to my channel. Today's video is going to be about post-op instructions, things as dental assistants that we tell our patients after a procedure, just to kind of help them with any pain they might be having or just instructions to take care of whatever restoration or procedure we just went through. So the first one I'm going to talk about is a root canal. So when a patient gets a root canal, it is when the dentist removes a nerve of the tooth and we replace it with like a filling material and a medication. Now, root canals, since they remove the nerve of the tooth, it does make it so you're not going to have any more pain with that tooth, but it does weaken the tooth. So the dentist will place a temporary restoration because they want to give the tooth a few weeks to see how it reacts to the root canal. Depending on the reason why you got the root canal, they want to see if this tooth is reacting well to it, if it's taking well to the root canal, or if it's still going to infect, or if there's still an issue, if you're still having pain. So usually they wait a few weeks before they place the permanent restoration and start the crown prep. So I always advise my patient after a root canal just to be careful with that tooth. Don't chew anything crunchy on that side, anything hard, because it could break it or it could pop out the temporary restoration by accident. And then of course to let us know if that temporary restoration comes out, because we want to make sure that that's sealed up, that root canal area, because you don't want any bacteria getting in there. So you want to make sure that it's sealed up. Also to let us know if any swelling happens, because that may mean that the root canal is failing. Also, that it is a temporary restoration, that they need to come in within the next 6 weeks to get that permanent restoration in or starting the crown prep. Temporary restorations are not made to last. They need to be replaced. So I've seen patients come in and we start a root canal or do a root canal, and then we never see them again for their permanent restoration. Then they come in like a year or two later and that tooth is completely bombed out and it's decayed and they need to get it extracted, because the temporary restoration is not meant to last a long time. And if you leave that in there too long, the bacteria gets in there, you could get decay, or it can make the tooth reinfect. So you want to make sure you come in and get the permanent restoration placed. So that is what I usually tell patients after a root canal. I also tell them their gums may be a little bit sore, because for a root canal, we do have to place a rubber dam, and that's at your gum line, so it could be sore for a little bit, to take ibuprofen to help with that. When a patient gets a filling done afterwards, if it's an amalgam filling, I will tell them to not chew on that side for 24 hours, because it takes about 24 hours for the amalgam to harden up. When a patient leaves after amalgam filling, the amalgam is still soft. It needs time to harden. If it's like a posite filling, I tell them that that tooth is as hard as it's going to be, the filling is as hard as it's going to be, so that they are able to eat or whatever they need to do on that side, but to be careful with the numbing, because you are leaving numb. So you want to make sure you're not going to chew your tongue or lip by accident, because you could really do some damage if you eat something really crunchy or hard to chew after a dental appointment if you're numb. You want to be really careful. And usually it takes about 3 to 4 hours after your dental appointment for your numbing to fully wear off. I have seen a lady come in that after a filling, she went and ate Mexican food, and she went and ate chips and salsa and stuff and chewed up her cheek and her inside of her lip and her tongue. She came in the next day and it was all just like, it was bad. Please be really careful with eating after your appointment. So I will tell them after a filling, you can eat, but just be careful, or you could wait a few hours until that numbing wears off. Now, after a filling too, I always tell patients that the tooth can be sensitive up to 6 weeks. We have so many patients that will call us a few days after a filling and be like, oh, my tooth's hurting, or it's really sensitive to cold. That's because it's your tooth reacting to the filling. So when we cut on a tooth to place a filling, or we remove decay or whatever it may be, of course, every tooth has a nerve inside, right? So when we remove material from a tooth or tooth structure and we place material in there, depending on how close that material is to the nerve, your nerve is going to retract away from the filling. That's what we want it to do. We want it to move away from the filling, but that takes time. It takes up to 6 weeks. So when we first place that filling, your nerve is closer to that filling than it will be in 6 weeks. It's supposed to retract away from that. So that takes time. So your tooth may be sensitive to cold, it may be sensitive to hot stuff, it might be sore. So just give it some time, take some ibuprofen, and then if weeks and weeks go by and it's hurting or it hurts really bad, then yes, let us know when you take a look at it. Also, once the numbing wears off, If you bite down and you feel like your teeth are not coming together correctly, or you feel like you're hitting that tooth first, let us know. You need to come in and we need to smooth down that filling because we want to make sure that your bite is correct. That can cause some pain as well. And then if the filling is left too high for a long period of time, it could cause that tooth to fracture or break off the filling. So that's important to remember as well after a filling, or to let your patient know. Extractions. So extractions, we always send home with post-surgical instructions. So these are things that the patient needs to do in order to prevent a dry socket. So a dry socket is when a patient pulls out the blood clot that is formed in the extraction site. The extraction site will still heal the dry socket, it just makes it more painful for the patient. So we always advise them not to create any suction in the mouth the next few days after an extraction. So no straws, no spitting, definitely no smoking. And I know that's really hard for patients, so usually you can tell if someone's a smoker. Like, they have kind of like a smell on them, but I always ask them, are you a smoker? And if they say yes, I say, you know, if you can not smoke for the next few days, that's great. At least this evening, don't smoke. Usually they don't listen to us, but I will say if you do choose to smoke tomorrow, please rinse out your mouth with some water afterwards so there's no bacteria that gets in that extraction site. But you want to be careful with that. So when they brush their teeth or rinse out their mouth, you don't want to be swishing around water vigorously. You kind of just want to put water in your mouth, shake your head around, and let it drip out into the sink. Also, no like crunchy foods that evening. You want to ask them to rest that evening. Don't do any like strenuous exercise, things like that. But the biggest thing is you just don't want to remove that blood clot from the extraction site, because then they're going to have dry socket and it's going to be painful. And if that does happen, I advise the patient to give us a call and come in, and we can place some medication up there. It's like a clove oil medication. And then that will kind of like be in there like a blood clot until that extraction site heals. So post-op instructions for people that come in and do like a full mouth extractions and then get dentures, immediate dentures, which is great to do, by the way, because when you leave, you're going to have your dentures in place, or the patient's going to have their dentures in place. So all those extraction sites are going to be covered up. It's going to help with bleeding and making sure they don't disrupt those areas or those extraction sites. It also is going to help with swelling. So if you do a full mouth extraction on somebody and they get a full pair of dentures or partials, they need to come in the next day, because the dentist will remove the dentures, take a look at the extraction sites, make sure they're healing up well. But you want to tell that patient to leave their partials or dentures in all night long, that the dentist will remove them the next morning or whenever they come in for their post-op check. Because if they were to remove those when they get home, the gums are going to swell, because of course there's been extractions done, and they're not going to be able to get that denture back in. So they want to make sure they wear that all evening, just to kind of help with the bleeding, keep the swelling down, and keep those extraction sites covered up. So I always tell them just to leave it in, don't touch it, and then the dentist will remove them in the morning when you come in for your post-op. And then also the dentist the next day will do any adjustments if needed, any sore spots that have developed, they'll kind of check that. And of course the patient will keep coming in, you know, the next week, the week after for any adjustments, and then the liner in the future and things like that. Another little procedure that you can do is like sealants. And sometimes when you place sealants, the sealant is a little bit high, but since it's not a filling material, it's not as strong as a filling material, they do grind down. So I always tell a patient too after sealants that if it feels like it's a little bit high, just after chewing and stuff for the next few days, it will smooth down. And if it doesn't, to come back in and we can smooth it if it's too high. But you should make sure your sealants, you're not overflowing the pit. You want to make sure that it is, you know, smooth, but sometimes you do place a little bit too much in there, but it will smooth it down. So I always tell patients that after sealants as well, that their bite might feel a little funky the next couple of days, but their chewing and eating should smooth those down. And if it doesn't, then to let us know. Crown preps. So of course, after a crown prep, your patient is going to leave with a temporary crown. Now, a temporary crown is a temporary crown. It's not very strong. So I always tell patients that you want to avoid chewing on crunchy, sticky, hard things on that side until they get the permanent crown in. Also with flossing, if it's on the bottom, you want to pop the floss down and pull through. You don't want to pop it up. And then of course on the top, you don't want to pop it down because it could pull off the temporary. And then if the temporary does come off, use toothpaste to get it to stick back on there if you'd like, and then come and see us and we can cement it back on or make you a new one. And in my office, it takes about 3 to 4 weeks between getting, you know, for them wearing their temporary crown until their permanent crown comes in and they come in to get that seated. And I've had some people in the past ask how patients respond to that, and honestly, patients are fine with it. You just have to make sure you're making them a good temporary, make sure that temporary is going to last. And I do have a video on how to make temporary crowns. If you guys are curious about that, I can link it here. But yeah, so they're going to come back in a few weeks and then get their permanent crown placed. But I just advise them to not chew on sticky foods or hard foods, and just to be careful with that temporary. Just baby it until they come in. Yeah, that's all the procedures I can really think of right now. I think that's pretty much all the ones that we do post-op instructions for. And usually your office will have some kind of paper you're going to give the patient after these type of procedures, just as a reminder. And if you have any other suggestions, please leave them down below. But yeah, I hope you guys found this video helpful, and I hope you guys have a great day, and I'll see you in the next one. Bye.